How's everybody doing? You've likely heard about the typical symptoms, tightness in the chest and in your right arm, but there's a lot more we could learn about heart attacks. Dr. Himanshu Agarwal is joining us now from the Heart South Cardiovascular. And first off, he joins us via the phone. How are you doing today, Doc?
I'm doing well. How are you, sir?
Good. Can you tell us, what does a heart attack feel like?
I've been in this field for almost 10 years, and you would not believe how differently the heart attack feels to different patients. Most common symptom patients describe as severe chest discomfort. Some people say as if elephant is sitting on their chest. Some people, all they have is some jaw discomfort, and they just, they come in and they just cannot get rid of that jaw pain. Some people tell me they have arm pain. Left arm pain is most commonly associated with heart attacks. A lady, I remember, I can never forget this story. 36-year-old female, diabetic, all she had was nausea. She just had this bad nausea and she could not get rid of it. And of course, she was having a massive heart attack. So in a nutshell, different patients present differently, but most common symptom described by patients is severe chest discomfort.
Yeah. So what are some of the treatments that need to be done if you've experienced a heart attack?
First thing you need to do is call 911. You need to get to the nearest medical facilities, nearest ER. The doctors over there can evaluate your symptoms, can look at your EKGs, can check your labs, and see if you're having a heart attack. The gold standard is patients have to undergo an emergent coronary angiogram, where we can look at their blockage, see which artery is blocked up, and then open that up immediately as soon as possible. In our field, there's a saying called time is muscle. Time is muscle. What it means is the quicker you get to the ER and the sooner we can open up the artery, the better the chances of reducing the damage to the heart from the heart attack. So that's the gold standard of treatment, coronary angiogram.
Yeah. And what are some of the best treatments to prevent a heart attack? What's the best way to prevent a heart attack?
Yes. So we basically, I usually tell patients to establish your care with a cardiologist, where he can review your medications, look at your risk factors. If someone is a smoker, we tell them that please stop smoking. Someone is diabetic, we encourage them to try to keep their diabetes under control, review their medications, review their exercise plans, dietary changes, and review lifestyle modifications and see how we can prevent heart attack. But a lot of things can be done in terms of modifying risk factors and trying to come up with a good strategy. So establishing care with a good cardiologist where they can review the chart and help prevent heart attack, that's a good strategy.
And just real quickly, we're under 30 seconds now. Man or woman, we're all at risk for this? Men are more common to develop coronary artery disease, but females, as they age, they are also at higher risk to develop coronary artery blockages and have heart attacks. So, anyone with risk factors and should be evaluated by a cardiologist. Hey, we certainly do appreciate your insight on this, Dr. Himanshu Agarwal. We appreciate you joining us via the telephone today, and we wish you well and hope to see you very soon, okay?
Thank you very much.
All right.
Thank you.
Take care now.